everybody. So my name is Yein. I'm an associate professor at UNT-HSC, Texas College of Osteopathic Medicine. I'm going to talk about music medicine today. So before I go on, you guys just watched two different videos. The reason I started with those two videos is because I often do not see people considering musicians as athletes. And in the beginning of this talk, I'm going to try to argue for that. I'm going to try to see if I can compare musicians to athletes. And that video is the first of my many sort of attempts. You could see that violinist Joshua Bao, the first video, and how physical his performance was. And you saw how in the second video, the marching band musicians, they were not only trying to perform and play beautiful music, entertaining music, and but excellent music, but at the same time being choreographed movements, they were dancing, and how physical and difficult this could be. And I would like you to consider that. And so with all that said, are there similarities between musicians and athletes? Yeah, of course. They have great strength, flexibility, endurance, coordination. They are talented, highly capable. Their physical skills determine the level of success. So, if they're very skilled at their play, they're very high at their level. Starting to train at a young age is also a very similar aspect of both musicians and athletes. For example, I started playing the piano when I was 4. Not that I'm good at piano, but my mother's a pianist, so I had to start playing the piano very young. I started playing the violin when I was 6, very, very young, right? And competitiveness, their world is very, very competitive, both musicians and athletes, lots of auditions, training and things like that, right? And then perfectionism. They both are a group of people who seek perfectionism, who pursue perfectionism. Let me go into this further. Let's see, take a look at an example of a jazz pianist and a vessel player. So this is a sort of a scenario of both of them. Let's say they wake up late because they went to sleep late. They'll have performances maybe in that afternoon, that evening. And so when they wake up, they may or may not have breakfast. They'll have some free time or practice time until the mid-afternoon. And when that's about when they arrive at the venue for sound check or practice. They'll have a meal before the gig or game, sometimes very light meal. They'll do a little warm-up. Sometimes athletes will do a little video review. The game will start at 7 p.m. Gig will start at 7 p.m. And then the performances, the game will finish around 11 p.m. Afterwards, they'll inevitably have a meal. Maybe they'll have a little session of recovery. And then either they go back home or go to a new city for new performances, new gigs, new game, etc. So I'll talk about an example of a pitcher. So this pitcher would be a very high level athlete, either, a collegiate athlete or a professional level athlete. This person would have a nutritionist to help understand what to eat, what not to eat. This person would have athletic trainers, PTs on site, sports medicine docs, either on site or easily accessible, so that there could be a real-time evaluation if there's injury. There could be a support for injury prevention, rehabilitation. There could be a postural evaluation for optimized play. There is something called pitch counts to reduce the risk of overuse injuries. There are sports psychologists, probably on site or easily accessible, to help support for mental fatigue, anxiety, depression, performance anxiety, etc. Well, let me give you an example of a patient that I had who was an opera singer. She's been seeing me for a couple of years now. And she recently had a very, very big audition a few months ago for a lyric opera in Chicago. She came to see me 1 week after her audition, and she told me this story. 1 week prior to her audition, she had 2 performances, 2 auditions, 3 private lessons, so she could pay for her trip to Chicago. For a 3-day audition, she couldn't stay at a hotel the entire time, so she stayed at her friend's house, just in case she didn't make it to the final audition, right? And she is a great singer. She made it to the finals. And for the 3rd audition, she stayed at a hotel, which she paid for out of her own pocket from her lesson money. During that time, she actually had to pay for her own virtual counseling session because she had a lot of anxiety related to this trip and this audition itself. Number one is, of course, performance related anxiety, but also was during the pandemic, and she was flying there in a plane at a time where respiratory disease was everywhere. And she was quite anxious, and she was really worried about the possibility of her voice being compromised by COVID. She flew back from to DFW after her few days of stay in Chicago. And she told me on that day when she came and landed, she had another performance. So at the end of the day, performing arts medicine is really similar to sports medicine in many, many different ways. Let me give you an example. A good performing arts medicine encounter should include musical history, their pain level, their psychological factors, playing environments, practice habits, if there's any changes in play form or teacher or new music, new repertoire, other non-performance related activities as well. We should have a very thorough medical screening to rule out other serious disease and disorders. And then we need to provide appropriate treatment. This is really similar to sports medicine in many ways because it should include postural and playing analysis. We should have appropriate counseling for rest, bracing if necessary, home exercise programs. We should be able to prescribe appropriate medications as needed, physical therapy, manual treatments. Some of us were DOs, and providing OMT appropriately for the disease processes as you see fit could be very effective. And then appropriate referrals and treatment coordination. This is kind of why I always have argued that physiatrists are perfect for performing arts medicine. We are experts of injury, physical medicine. We are experts in rehabilitation. We're great at managing very complex issues that involve the whole person, not just the disease process, but their environmental issues, their psychosocial issues, financial and others. We're also great at working with other healthcare professionals, physical therapy, occupational therapy, speech therapy, orthopedic surgery, ENT, neurology, rheumatology, primary care medicine. So great. We're great at coordination and organizing care for our patients and working as a team. And so this is what our performers need, just like sports medicine for our athletes. And I am going to continue to argue that physiatrists are perfect for this field. And our musicians, our population in need for healthcare. So what are we going to talk about today? I'm going to go over who are performers, maybe try to see if we can help all of you get to know them a little bit better. And then I will share how I evaluate them. And then I will talk a little bit about what I see most often. Maybe I'll cut that a little bit short because we're all physiatrists and you guys are all sort of experts in these musculoskeletal disorders. Well, I'll try to talk about unique things about music medicine amongst those pathologies. So first, are performers different? Yes, the answer is yes. So musicians, they start playing in an early age. I already talked about that. And so what's so significant about it? They might actually become anatomically shaped to their instrument as they grow. So for example, I started playing like this, but I was very little when I started, right? So as my bones and muscles grow, my body grows into the instrument. This is something to consider. Those of us who practice osteopathic medicine, right? That's even more relevant for osteopathic findings and things like that. And then their problems, they might have had it forever because they started very young. They're highly motivated people. Yes, they're motivated and they're goal-oriented. They often feel like their art takes precedence over their physical conditions. They play through pain, they play through suffering. They're freelancers. They do not get paid if they don't play. Now, finally, small changes can affect their play. And this is really important because sometimes our musicians will walk in with a very strange chief complaint. For example, I had a musician one time who's a pianist who came in and told me that he had pain right here, just a singer, on the index finger, once in a while, not all the time, but only when he plays. So what do you do with that, right? Of course, those of us who see musicians often is really not a unique story. It's not a unique chief complaint. For physicians who don't see musicians very often, it's a very strange chief complaint. And on your physical exam, it might look really normal. On palpation, they might not have any pain at all. If you think, I mean, I don't think it would be appropriate to order imaging, but if you do order imaging, it's going to be normal. So what do you do with that, right? Well, you have to first understand that even though this chief complaint sounds really subtle and maybe a little strange, but it's very, very significant in their life. For example, some doctors will say, well, if it only hurts when you play, you should just stop playing for a while. Sometimes that's not a good answer. It's not a good solution because, well, again, didn't we just talk about that? If they don't play, they don't get paid. And a lot of times playing, being a musician is part of their core of their identity. And it's really all they have. So if they can't play, their life is horrible. It's really who they are. And so we have to do our best to understand where they are psychologically, mentally, spiritually, also physically, and really focus on helping them function better, which is for them to play, right? So that's really important. Now, we talked about how different they are, but I wanted to mention that they're also different neurologically. This study that I'm quoting here is it was published in 2017. There are a lot out there. If you look and search a little bit, there's a lot of literature out there studying the difference between musician brain and versus our brain, like the mere mortal brain. There's plenty of functional MRI studies out there. This is actually a structural study showing how musicians in blue, they had greater cortical thickness compared to controls. It's interesting because this study, just like all the other ones, they've shown greatest changes in superior temporal regions. And that's kind of obvious, right? As a physiatrist, that makes kind of perfect sense. So not just different in their social life, in their work life, their home life, their identity, not just different in their physical injuries and what they do, but also different central nervous systems, different. Musicians are different. Now, what do typical musicians look like? Well, I see a lot of collegiate musicians. First thing I would say is that they have a lot of stress, a lot. I feel like I also teach medical students. They're so similar, the music school students and medical students. High stress, high anxiety. A competition steep. They have long hours, rehearsals, performances. They travel a lot because, for gigs and things like that. Their financial health is very poor, almost always. This directly links to the access of care, which I'll talk about a little bit later. And I mentioned it a little bit earlier. They do not exercise. Their diet is absolutely horrid. They do not eat well. They have this grit, sort of this attitude of no pain, no gain. Some musicians will say, well, like, I don't really know anybody who doesn't have pain when they play. Playing with pain is quite normal. I heard that a lot. Actually, I heard that a lot when I used to play too. My teachers would say, well, yeah, of course you have shoulder pain. You play a couple hours a day. That's just normal. And I thought it was normal too. And finally, they don't really see doctors. They fear the treatment may threaten their performances and demand impossible changes in technique. They're fearful of medications. They're fearful of interventions. They're fearful of surgery. So how do we evaluate and treat musicians? So first, I think it's really important to learn the background. What do I mean by that? So I think it's really important to understand that in the music world, there's so many different types of instruments, and these instruments dictate their injury risk. For example, if you play the flute versus, piano, Some of the musculoskeletal injuries that you're going to see are going to be very, very different just because of the instrument that you play. I'm just talking about Western instrument, but what about, others, right? I recently saw a sitar player, and I realized because of the way they sit with their instrument on their lap, a lot of times they have lower limb issues, very unusual for musicians because a lot of musicians have upper limb issues. What about genre and ensemble, right? If you're soloist versus you play in an ensemble, or if you are jazz pianist, or if you are in a rock band, or if you're pop musicians, if you're a musical theater performer, you're a K-pop artist, you're dancing and singing and doing all these things on stage. So different. So understanding what they do is so important. If you're a singer, you're voice users, obviously, you need to understand that they don't really use an instrument, but their body is an instrument, right? So understanding that's really important. Where do they perform? Where do they rehearse? Really important. If they're in a small room, play very loudly, right? Versus, if they're in a pit orchestra where the lighting's really poor, or your venue or your ensemble, your rehearsal space has really poor lighting and really horrible temperature control, so it's too hot or too cold. These all affect their musculoskeletal health. Hearing health is important. Volume of sound, how much they play, how loud they play, prevention, education, so important. Mental health, substance use issues, anxiety and depression, performance anxiety, huge problem amongst musicians. And then, of course, not forgetting about those who support the musicians and the performers, those who are in the backstage, those who are doing choreography for musical theater performers or K-pop stars or others, costume staff, sound team. These are all important part of understanding the background of the music world and taking care of them as a physician. Understanding their language, learning their language is important. If you're seeing a violinist, and you should probably know that this is called a bow, right? The first picture. You should probably know that that's a shoulder rest. When you're seeing a drummer, you should probably ask, are you using an American grip, German grip, French grip? If your musician is telling you, my fingers only hurt when I do pizzicato, you should probably understand what that means. If your singer says, I have such a hard time with my passaggio, you should know what that means, right? You should know that clarinet, mouthpiece, reed, the anatomy of the clarinet. If you're seeing a clarinet player, you should probably know that oboe is a double reed instrument. These are some of the things that you should probably be aware of when you are seeing a musician. You also need to understand the risk factors. I talked about that when we were talking about the background a little bit. Extrinsic risk factors for injury, like type of instrument that they play, venue, light, noise, music, conductor. This is something that if you're a musician, you would understand, I think. Depending on who leads the ensemble, it really makes a big difference in their injury risk and their mental health and overall health in general. For intrinsics, the musicians themselves could be a risk factor because their daily activity, their health habits, their playing position, playing schedule, the amount of breaks that they get, amount of pressure that they have, amount of sleep that they're getting, and fatigue, all of the above. So comprehensive care for performers, especially as an osteopathic physician, I think of these three things when I see a musician. Think about medical care, especially the access of care, and prevention and education, and mind and spirit, body, mind, and spirit, or mind, body, spirit. And the holistic care, treating the entire person, individual musicians, where they work, where they live, where they play, all very important. I was saying for the access care for performing arts medicine, medical care, the biggest struggle for us is actually providing the care itself. We mentioned that financial health for musicians is usually poor. Insurance is hard to come by, especially in this DFW region in Texas. So when they don't have money, they don't come and see you. So oftentimes they come and see me for catastrophic injuries, and that's very difficult. So we do a lot to try and see if we can provide care, just to have them access to care, because even that is just very difficult for them. Like I was saying earlier, physiatrists are perfectly qualified for providing medical care for performing arts medicine, because we create a scene. We are experts of physical medicine, and we are experts in musculoskeletal medicine. But at the end of the day, good care is taking good history, great physical exam, and really going through each individual musician and their injury in a detailed order, not forgetting what they do, where they work, what they do when they work, what they do when they don't work, and really understanding what their instruments are like, what they do with their instrument, and seeing them play their instrument is so important in the evaluation. If they're voice users, their body is an instrument, right? So it's really, really important to see them actually perform in front of you a little bit. If they have a hard time performing in front of you, having them bring a video of their performances or video of their practices and rehearsals, those are also really important too, as a part of the performing arts medicine assessment. I'm not going to go so much into details because I think as physiatrists, you know how to have a effective and you know how to take care of these patients. I'm just going to go and just provide a little bit of a unique detail that I would like you to never forget when you see musicians. When I see musicians, I always, always, always talk about lifestyle. I ask them about aerobic exercise. I always ask about some kind of exercise routine that is really known to help body awareness, and also mindfulness, like yoga, tai chi, and things like that. Talk about diet, talk about hydration. They're a small muscle athlete. They need to be hydrated. They need to sleep well. By the way, musicians do not sleep well. They go to sleep late, or I should say early. They usually work throughout the night, really, and their performances are at night. So it really, they sleep during the day and work at night, perform at night. Really difficult to get a good night of sleep for each musicians. Their stress is enormous, so managing stress, and then really asking questions and watching alcohol, cigarettes, coffee, illicit drugs and things like that. Really important for muscle function, decision making, and things like that. Even to this day, this is very common. I was recently at a conference and they had musicians at a panel. And one of the musicians were saying recently he was playing gig, and instead of getting paid with money, they were offering to pay in cocaine. And that just blew my mind. To this day, are they still doing that? That's so crazy how environment that they work in can be so not helpful for their health. So just keep that in mind when you're asking them for their social history. And of course, I ask about their playing habits, checking their instrument, looking at their posture, looking at their neck, spine, you're very good, the postural exam, right? Looking at pressure on the shoulder, wrist, finger joints, if they're minimal, if they're, it could be better, asking those questions. If they're asking if they're using large muscle groups, if they're even aware of that. How's their warm up and how their cool down? Where's your stand? Is it eye level? Is it below? Is your stand part like super tall, so you have to like look up? Or if you position in an ensemble so turned that for you to look at the conductor, you have to turn your body dramatically, right? Those are so important. Body awareness, being aware of the fact that if things start, don't playing through it, stopping, right? And understanding that breaks are not bad, taking short breaks every few minutes, longer breaks each hour. 2 or more shorter practice session is like better than having like marathon single sessions, right? Like these are kind of common things, common logical things our musicians sometimes don't know. Even in performances, finding opportunities to relax, instead of, if you look at this flute player, when they're resting, sometimes they just kind of rest with their instruments sort of on their body instead of actually, instrument their hand and resting and keeping their posture a little bit more neutral. Being aware of that and reminding them of that is really important. What are they doing when they're not playing? For example, I had a collegiate musician. When he was not performing, rehearsing, practicing, you know what he was doing? Playing video games. His thumb hurts all the time, right? Logical things, making sure that, when you are not playing, are you on your computer writing your dissertation like this? Horrible, right? And so just being able to ask those questions, relating to them in their life is always really helpful for our musicians. And also, being an osteopathic physician, always asking about their spiritual practice, religious practice, meditative practice. If they don't have that, having some sort of resources for, maintaining healthy mind and spirit, right? Changing the culture a little bit from this grit mentality to being okay sharing that they're not doing okay. Convincing the ensembles, the orchestras, and others to be okay with providing the support because of their occupation. They go through these injuries, and sort of changing that culture by outreach and education sessions. These are all important part of my practice. Knowing the science of performance anxiety is a very important thing in our world as well, because this directly affects their play. So, they're coming in and telling you about heart rate, breathing issues, dry mouth, tremors, sweaty and cold hands, nausea, vision changes, and things like that. You would need to be able to coordinate care with counselors, maybe be able to provide some medications to help them perform at an optimal level, but also addressing existing generalized anxiety and things like that for patients who are suffering from performance anxiety. These are all really important aspects of our practice. Oftentimes they know that they have performance anxiety and they come in asking for medications and things like that. And it's really important for you to take this opportunity to counsel them about, dealing with their existing general anxiety, generalized anxiety or depression, and, really utilizing the opportunities so that they get help from a mental health professional, because oftentimes they don't really do that. It's hard for them to reach out to mental health professionals. Now, I'm going to go briefly into some of the pathologies that I see most often. You are all experts in seeing musculoskeletal pathologies. So I'm going to try to see if I can just layer some of the perspectives that you need to have when you see musicians, even though you see these common pathologies often in your office. But what do you have to think about when you're seeing a musician, right? I'm going to try to layer that if I could. Okay. Now, one diagnosis that you need to be aware of in the world of performing arts medicine, music medicine in general, is this PRMD, what we call playing-related musculoskeletal disorder. We have this very, very vague definition: any pain, weakness, numbness, tingling over other symptoms that interfere with the ability to play your instrument at the level you're accustomed to, usually with increased playing. When you hear that, you think, oh, this is probably overused. Musculoskeletal disorders. If you are an osteopathic doc who does a lot of OMT, you can even say, oh, this is probably somatic dysfunction related to performance and play and etc. Right? What I would like to emphasize here is this increased playing related to playing, right? This aspect of how musculoskeletal disorder related to play is an occupational injury. When you think about occupational medicine, we don't really think about musician injuries. I didn't before I saw musicians often. And I think it's really important as physiatrists to understand is that this is occupational-based injury, occupation-based problem. And as a population, musicians and people who employ musicians should understand that musculoskeletal disorders are so common as related to their job. So I think from there, what we could really kind of think about when used to musicians, chances are, like the mantra is that musicians, they have upper limb injuries, and dancers, they have lower limb injuries, of course, because they're related to what they do. You know, if you're looking at a flautist like here in this picture, right? You can see that because of this asymmetric position, you would have a lot of injuries associated with that musculoskeletal injury. If you're in TO, you can pretty much assume, right, that this right arm would have a pronation injury in the forearm, what we call a posterior radial head, or this side could have more of a supination injury in terms of a somatic dysfunction perspective, not like a pathology perspective per se. These are some of the things that I consider when I see our musician in our office. Of course, overuse injuries, right? So common. Most injuries in performing artists, musicians are related to overuse. Of course, like we were saying, the exact injury definitions are kind of hard. If you look at the literature, I think for sure you can assume that musculoskeletal complaint in general dominate my practice. And a lot of this is basically because of overuse. And complaints directly depend on the amount of time performances in play in many ways. I mean, do I know the exact number? No, because it varies amongst musicians, but it's just really common. So, the pain, the repetitive strain injury, the tenderness in the muscles and myotendinous junctions, and tightness, stiff, cramping, fatigue, swelling, all these sort of overuse syndrome type thing, I see it common. Tendinitis, tendinopathies, right? I should say more. Lateral medial epicondylitis or extensor flexor common tendinopathies, Dick-Ward synovitis. I see it often. And of course, entrapment neuropathies, median neuropathy at the wrist, ulnar neuropathies at the elbow, right? So common, so common. So I would say a lot of that, right? MSK, overuse, pain-related musculoskeletal disorder, somatic dysfunction, so common in my office as a presentation. One thing that I do really see commonly also in my office is hypermobility. I would say, if you look at the literature, some papers say up to 20% of musicians, obviously in the upper limb, more fingers and wrists, more common in young females. I would say obviously there are inherited causes of hypermobility like Marfan syndrome or EDS, but joint laxity acquired by chronic ligamentous stress from playing all the time is really common. Like, for example, I'll give you myself as an example. This is on video, so I don't know if you'll believe me or not, but look, so this is my left hand and I'm gonna abduct, right, my fifth digit, my pinky, and my abduction of my right hand, or right fifth digit. See the difference here? And that is because since I was very little, I was trying to reach high positions with my fifth digit. So I have a lot of laxity, my fifth digit right here. Right. So something like this is really common. Like, for example, a flautist with the fifth digit, they do this a lot. So they have a lot of instability there, or a clarinet player, right? Reaching back like that. So common to see things like this. Or, a cellist who have been just kind of, because peg is right here, they're sometimes like this, and they have a little bit of an instability sort of this way, or violinist instability this way a little bit. Just a little bit of a ligamentous stress that's ongoing since they were very little. It makes sense, right? One funny story behind hypermobility with musicians is the story behind Sergei Rachmaninoff, very famous pianist and a composer, and his piano concerto, so famous for being technically difficult and ridiculously complex. And Schoenberg apparently had described his hand as supple, spectacular, and phenomenal hands, a little strange description. And some doctors have suggested that he had Marfan syndrome. I read this paper, a British medical journal, published in December 1986, I think. They described how he could have had Marfan syndrome because he was tall and slender. He had long limbs and huge hands. Look at his hand in this picture, right? And I think this is really interesting. Apparently, this is what he could do with his hand. This is C, E flat, G, C, and a G. 12. That's insane reach. I would never be able to do that. It's just like impossible. Common joint disorders, you see this often in your practice, right? Axial joint disorders, DJD, DDD, osteoarthritis, especially for our aging musicians. Just understand the impact of a degenerative joint disease on our musicians is really tremendous. They have a hard time with it. And they're afraid to get more interventional type of treatment. So being sensitive to that is important. I just mentioned rheumatoid arthritis because I've had several patients in my practice who just didn't come to see us fast enough, who have pneumatoological diseases, rheumatoid arthritis, Sjogren's disease, and others, that their synovitis and their joint disease so severe that their career just had to change from performance focus to like teaching focus or others. Just the importance of how outreach and availability for healthcare for musicians is so important. Oral facial problems are very, very, very common in my practice as well. TMJ, either dysfunction, the joint disease, the dysfunction, the syndrome, TMJ syndrome with the myofascial pain of muscles of mastication. I see them all. For violinists and viola players, because of the pressure on their mandible, maybe they're just really stressed type A, they're grinding and they're crunching, and then on top of that, they're playing for hours on their chin rest. Woodwinds, the breast players with embouchure creation, they have a lot of stress to the joint, also surrounding myofascial structures, especially orbicularis, oris, pterygoids, and things like that. They play a big role in injury. Dental problems. I have actually a couple of saxophonists and other reed players who actually cover their incisors because they're so sharp and they bite into their gums and things like that, and they create sores and rashes and lesions. Dry mouth is a really big deal as well. So, particularly for wind and brass instrument players, there are certain patients who are just like really, really sensitive to allergy medicine and they've never taken it, and they come to Denton. They're collegiate musicians, and then basically allergy capital of the world. Like, I mean, dust, pollen, everything, all the things. Denton is just really terrible with allergies, and they start taking these allergy medicines, start to have really bad issues with dry mouth, and come in and see me, and they're like, I have this really horrible dry mouth that I'm having a really hard time playing. And it turns out that it's allergy medicine. These are some of the unique sort of issues with musicians that normally you would really think of when you see patients in your office that are not musicians. I'll mention focal dystonia a little bit. It is not common. I don't see focal dystonia very often in my office, but I do see a case or two every year. Focal dystonia is a movement disorder, obviously, and it only happens when they play. It's a task-specific dystonia, and it is a very scary diagnosis because they often have to sort of change their they have a huge change in their career because of it. This is Leon Fleischer. He's a very famous pianist who had focal dystonia, and he said, I was desolate, my life fell apart. I'm really literally, this diagnosis changes their life and flips their lives upside down, basically. Patients will complain of subtle loss of control in fast passages or any passages, lack of precision, finger curling, irregularity of trills, fingers sticking on keys or strings if they're string player or keyboard player, involuntary flexion of the bowing thumb for string players, impairment of control of embouchures, which is the lip correct movement of the lips if they're horn player or reed player or things like that. And some people will say certain registers, they'll have hard time. Vocal dystonia overwhelmingly affects classical musicians compared to jazz musicians, for example, which is a super interesting thing for me. Many musicians think that their problem is due to technical problem, lack of practice. So they intensify their efforts to practice more to try to fix this problem, but this often exacerbates their symptoms. I think, this quote by Leon Fleischer, tells us that your patient's state of mind when they come to see you for possible diagnosis of vocal dystonia, even though you won't see it very often if you see musicians, a lot of musicians, when they have musculoskeletal disorders, they think that they have vocal dystonia. And it tells you how much of a panic that they're in. And it's our responsibility to help them see that although it's difficult, it's not dystonia, so you can help them if the diagnosis isn't that. But if it is indeed dystonia, then it's our job to really see that there are treatments available. They can work through things. Because, like I was saying, it really changes their life completely. I have a couple of videos on vocal dystonia. This is actually my patient. I'll talk about. It's a little bit unusual because most vocal dystonia patients are male and they're young in their late 20s, early 30s. But this patient, you can see that wasn't a very long video, but you can see that her jaw was moving towards the right. There's a little bit of a chin movement, and it gets worse as she plays faster passages. She's been playing in an orchestra all her life. She ended up retiring early because of this disease. Mental health is although I'm not a mental health expert, performing artists experience an intimate, intense, long-term relationship with their specific art form. And so their art form is tied to their identity oftentimes. Their lives involve sacrifices, defeats, but also victories. Performances is the center of their function, and they live for the performances. So, but they also work in a very hostile environment. And their finances are poor. They don't get paid very much. And so it is really our job to make sure that we at least recognize this and be able to provide resources whenever they can. I mentioned this before, but understanding the signs of performance anxiety and generalized anxiety, depression, substance use and use problems, these are all really important things for us to think about when we evaluate our musicians. I'm almost at the end of my talk. I'll have a few words on COVID-19. You all know that our musicians had a really hard time during the pandemic, with the heights of the pandemic. Lots of cancellations and closures, but a lot of them also used this opportunity to transition into this sort of unique art form of online streaming and social media. And they started to do a lot of really interesting artistic things during this time. On our clinical survey that I shared a little bit earlier, we also have a small question about COVID-19. And almost every single musician acknowledges that COVID-19 affected them negatively on their mental health, their overall health, and also their financial health. And now that they're coming back to play, they're coming into my office completely injured. When they came back to play, all of these ensembles, these shows and things like that, they were putting our musicians to use, but so much. And our musicians wanted to play, so they started to go to these performances and gigs. They're coming into my office with tremendous musculoskeletal injuries, overuse injuries, and things like that. And so I just wanted you to be aware of it. It's still the ramp up of the performances and shows, concerts, especially during the summertime, during the summer holiday times. It is really causing our artists to suffer with their health. So if you are in a position to help them, if you're in a position to see them as a doctor, please keep an eye on them for our musicians. This concludes my talk on music medicine. I hope this was really, really helpful, and thank you for your attention. If you want to reach me, I am very, very reachable. So you can email me, you can tweet if you want, although I'm not on Twitter very much, but I check once in a while. You can send me messages to Instagram as well. I check that often. And so whatever you want, I'm reachable. Thank you very much.